Hi, welcome to the Spot for Health. My name is Shirley and I'll be your host for the next half an hour talking about dentistry today, but health in general and where you can go in Sun Prairie for the best health opportunities. I'd like to also invite you to share these shows from the internet if you like to also review these shows on the internet. And you can do that by going to sunprairiemediacenter.com and looking around there, and you'll be able to share these videos with your friends and family all over the place. Anywhere there's an internet connection. That's how it works nowadays, right?
Yeah.
So today we have Dr. Lotowski here from the Wisconsin Dental Solutions, which is in our same parking lot at Primal Air. So they're the biggest sign on the in the little area that we're at there, and they do some really amazing dentistry over there. So Dr. Lotowski's been in that location now for how long?
Oh, it's been since 2000.
Since
So
2000.
it's been quite some time.
Yeah, it's a little staple right there
17
in
years now,
Sun
yeah.
Prairie. Oh my gosh, 17 years. That's almost as long as I've been alive.
Oh, happy to have you join our complex. That's right.
So we thought, because this is Halloween time, that we would talk a little bit about cavities in general
Yes.
and how and I know this is going to sound boring, but not everybody really understands it. And not everybody knows all the different words that we use for a cavity in a tooth.
Correct.
And so I thought maybe we would kind of talk a little bit about that and what it takes to get a cavity and how sugar isn't the big enemy. It's really kind of how you use the sugar. So why don't you start, Dr. Lotowski, telling us what do we need in order to get a cavity?
Sure. A lot of people don't know how that happens. We just go to the dentist and we realize they tell us, hey, you have these cavities and you're in shock.
Right.
That you have to take care of them. And the way cavities form is there's basically what you feed in, what you put into your mouth is a big factor, okay? And the other factor is what kind of bacteria you have in your mouth.
Right.
Okay? What happens is basically the bacteria in your mouth takes the sugars, digests them, and then literally poops out the acid.
Right.
Right? That's one way to put it.
Yeah, that's the best way to put it.
And the acid is what erodes the tooth.
Right.
And that makes the tooth kind of, if you would put it, melt away. It makes the tooth melt away in certain parts. And that's how a cavity forms. So that's the simple explanation to that. There's many factors that go into it.
Right.
Okay, and in terminology, it's basically, it boils down to 4 factors. It boils down to the host.
And that's the person, right?
The person,
Okay.
and what kind of, what do the teeth look like? Where are they positioned in the mouth? Is it hard to get to them? What kind of anatomy do they have to house the food, the bacteria?
Make little hidey holes everywhere,
Correct.
right?
Yep, so that's the host. The second would be the bacteria that you have in your mouth. Streptococcus mutans is the one that's responsible for the cavities. But there's people who don't get cavities no matter what they do.
Right. It's not fair.
They can eat all they want, and I've known some people like that. They can eat all the food and all the sugary substances they want, and yet not get one single cavity.
And they don't floss, and they don't hardly brush their teeth, and it's the worst when there's 2 kids in the same family, right?
Yep.
It's like the brother and the sister eats all the junk, and she doesn't get any cavities, and the brother's like a little flossomaniac, right? And gets cavities all the time.
What kind of example is that?
I
huh?
don't know. It's so unfair. So what happens there? Is it because he has a different kind of bacteria? Is he flossing too much? What is at play there in a family like that?
Yeah, I think it's all those factors combined that we're going to talk about here. And it is partly bacteria because there's people out there as well who like we said, don't get cavities, but perhaps get periodontal disease
Yeah.
or get gum disease. And maybe if it's in the form of gum inflammation, which is gingivitis, or if it's in the form of gum loss that happens to some people in a very early stage. There's a lot of hormones and bacteria involved in that process. But there's people who can just get periodontal disease and not get cavities, or get cavities, no periodontal disease, or neither. I mean, there's people who just don't have to brush, and that's rare, okay? I don't want that to be known as, it's really rare that that happens, by the way.
You still need to take care of the schmutz. You still have to
Correct.
do something mechanically to get the bacteria off your teeth, or recombobulate it or disturb it so that it's not so organized, because that's where the big problem comes in, right?
Correct. So we've spoken about the host. We've spoken about the oral bacteria, and third factor and variable, which is substrate. Which the substrate is what you put into your mouth. So what kind of products? What kind of how much carbs? You know, what's the makeup of what you're putting into your mouth? That's the substrate. And the fourth factor is time. So time plays. How long is this substance in your mouth? And what comes into play with time is the pH factor. So when we...
And that's the acid, right?
That's the acid.
Yeah.
So one thing is your bacteria in your mouth is producing acid. Now if you're putting acidic substances in your mouth, what's happening there too is you're helping that decalcification and that cavity start forming faster, because you're lowering the pH in their mouth, and you're kind of helping the cavities form faster and helping the bacteria cause the decay faster. So, and that's a matter of time. If you have a substance in your mouth, you say you eat something, it takes about 30 minutes for that pH to come back to normal level. So every time you put something in your mouth, it takes about 30 minutes for that to come back to a normal pH.
What is it that makes it go back to a normal pH? What happens that changes the pH in your mouth?
That's a great question, Shirley.
Aside
You always
from
have
food.
great questions. It's what happens in that process after we eat.
Yeah.
The biggest factor is saliva. Saliva then comes in and cleans everything out. And one of the issues that we're facing nowadays is people with dry mouth, which we'll kind of dive into as well. If you don't have that saliva to clean what you've put into your mouth, well, the bacteria can really do a lot of havoc at that point. Also, the lower pH is not, it stays lower for a longer time if there's no saliva.
No saliva, right.
To clean it out.
Because saliva buffers the acid, right?
Correct.
And it also dilutes the acid. So we have those two things working on the acid. And then there's other components in healthy saliva. I guess that we should make that really clear too, because you could have acidic saliva if your diet kind of goes more towards the acidic.
So what does saliva have? That would be the
Right.
next question. What
Yeah.
does saliva have in it? And it has different minerals that we consume, you know, and that we normally just house in our body. There's calcium, there's phosphate, there's natural fluoride that we also can release. There's different minerals that we can release in certain amounts, and that's what can calcify or help us neutralize that pH again and help us recalcify those teeth and bring things back to normal at that point.
Because enamel isn't static, right? It's dynamic. Every
Yeah.
time you eat, it kind of breaks down a little bit on a microscopic level, and then when saliva comes around, it builds it back up again.
Correct.
And if that balance is off, if you eat too often, which is the new way of eating, it's this grazing thing where
Yep.
we're eating, every couple of hours or less, and then that's where your time factor comes in, where you're continuously feeding the bacteria that live in your mouth, so they never have to stop making acid, so your saliva's working overtime. It's exhausting just describing it.
What comes in, that's the truth. And what comes into play here is you have to look at the whole system, you know?
Yep.
Because grazing and eating well, basically eating in smaller amounts throughout the day gives you more energy and keeps you going, and you're eating better things at that point. So, you know, what can you do so that it doesn't impact your teeth?
Right.
Would be the next question. I mean, and so rinsing your mouth out after you eat. To anything that will stimulate saliva flow is important. So xylitol products are important from that factor. Chewing gum can help in the meantime.
Right. Chewing gum is a real big favorite of mine.
Yeah.
But let's circle back for just a second before we finish on the saliva and the chewing and all that goes along with that, and kind of take a little trip down trick-or-treat lanes.
Thank
So
you.
your kid just comes home with this big giant bag of candy, and you don't want to take all the candy away, or maybe you do, I don't know. But you know, the kid worked pretty hard, and it's exciting, and it's a social thing, and now he has a big
Correct.
bag of candy, and then you kind of meter out the candy. So what's the best way to do that? Is it best to have one piece of candy a day? Is it best to have 10 pieces? When's the timing again with the candy? How do you work that?
This is all new to us as well. So here's my family dynamic and how it comes into play in my family dynamic. We have a 3.5-year-old daughter and a 1.5-year-old son, and so my son's going to be trick-or-treating for the first time, and he's too young to experience candy at this point. And we try to limit the sugar and the amount of sugary substances, because sugar is something that is addictive over time. So what we do with our 3.5-year-old, because she really enjoys putting on a costume and going out there and trick-or-treating. It's a blast for her.
Of course.
And so she comes home, she's really excited about what she has and what she's collecting. She's like, oh, I'm gonna eat this and that and this. And really, what we do is we set the precedence for it. We say, okay, we're gonna hold on to the candy, and every day you get one piece of candy. And over a certain time, that phases out, and we're left with this big bag of candy at the end that they've collected. And we hold on to it, and we kind of pick the candy that they're going to eat as well.
So if she has 30 pieces of candy that she's collected, then that's a whole month's worth of a treat for a meal time, or in the middle of between meals, or when are you recommending, or when does she have her candy?
So that's a good question. The best time to eat that would be sometime around the meal, like really close. Whether it's right in front of a meal, that's okay to have candy. It's okay to have dessert before you have the meal.
All right.
Okay.
That part's not bad.
That part's not bad, but as long as you have it together, and I think both you and I agree, Shirley, that having it at the same time you're having your meal decreases that chance of lowering the acidity in your mouth and causing the havoc to your teeth. So when you can have it all at once, then you only drop your pH once.
Once, right.
Not continually. And versus, you know, having that as a snack, or having a couple candies as a snack, you're continuously dropping that pH, plus the sugar content in that. You know, whatever, there's candy that is really acidic too. Sour Patch.
Oh, yeah.
Things like that.
They're awesome.
So they're fantastic from the standpoint that they're sticky. They stick to the teeth. They're acidic.
Above, right?
They're acidic at the same time, and they have food for the cavities to feed the to feed the bugs, so that they release the acid. Yeah, so
it's a dentist's best friend.
there's a full combination that goes into it.
Yeah.
Yeah.
All right, so really when you get right down to it, it's best to have all of the candy with a meal, Or every time you're going to have the candy, have it with a meal, or have everything kind of clumped together at the same time so that your pH is falling just the one time and your saliva can recover. And saliva is pretty amazing. Saliva starts changing its composition when you see and smell the food that you're
Correct.
going to eat,
Yes.
which I don't think that we have a real good handle on, or that we really kind of, we don't exploit that part of our physiology very often. And
Where
so,
does digestion begin?
yeah, exactly. Where does digestion begin? Everybody's talking about the gut. Hello, the gut starts right there behind your lips.
Yep.
That's where it starts.
Yep.
So I think that's an exploitable thing in dentistry that we don't do very much of.
Correct.
But we have a big problem in the United States in that everybody is on medication.
Yes.
And we have a lot of people that have dry mouth. And there are a lot of things that we can do to help our patients who have a dry mouth. So where do you usually start with a person that has dry mouth?
So there's things that can help with dry mouth. There's, like you said, there's a lot of factors that increase the chance of dry mouth. One of those factors is medications. That's been the most common factor.
Smoking's another. We don't see that
Correct.
very often anymore,
Correct.
but it's still right there. But the medication, I think, is big.
Smoking, medication, there's a lot of factors that come in. What is your normal physiology? You know, how much saliva do you normally produce? Some people have more dry mouth than others.
Well, what
Which-
about radiation?
Correct.
Like head and neck
Radiation.
radiation is really bad.
Trauma. I mean, there's a lot of factors that go into how much saliva you can secrete. There's help. There's help out there. There's products out there that can help. Okay. You know, we kind of dove into xylitol as being one of the ingredients that helps this process. So there's habits, and Shirley is very educated in these habits of what you can do to help decrease chance of dry mouth. And you know, whether it's chewing gum, that's with xylitol and sugar-free. Whether
So we
it's
have a little
candy.
graphic here
Sure.
that we can throw up of dietary changes that we can make for people with dry mouth that include the fewer simple sugars, right? And that would be like regular sugar. Eating raw foods that have sugar in, or foods that have water in them. Sorry about that.
And are encased in fiber,
Exactly.
which helps distribute the sugar load over time, because then the sugar has to be digested out of the fiber, and so it's not one big rush into your bloodstream, hiking the insulin and promoting diabetes.
So eating an apple would be better than drinking a glass of apple juice.
Correct. Yep. Simply put,
Yeah.
that's what happens.
That would be a good example
Correct.
of that. And then hydrating is another big thing. We eat a lot of really dry foods just because, I don't know why we eat a lot of dry foods, but we have another little graphic to kind of illustrate that hydrating is also important. How many glasses of water, or how much water do you recommend that your patients have in a day?
Yeah, the recommendation is 8 glasses of water. What constitutes a glass?
Yeah.
You know, it's 8 ounces of water, which is not much. I think that that's not enough. I think that we should
Really?
be drinking more water than 8 ounces. 8 ounces is a small amount. This cup is probably maybe 12 ounces here. So 8 ounces would be maybe this much,
Right.
just to give you an idea.
Just a little over half there, yeah.
That's not a lot of water. So
Especially if you're not eating water-laden foods.
what you'll see, one thing to pay attention if you're dehydrated is to look at your lips. How do your lips look? If they look dehydrated, then you're most likely not having enough water. And that is one way to judge it. But water is such an important factor in teeth and in our overall health, function for kidneys. I mean, just systemically. we need more water.
I agree. And if you don't have enough water in your system, if you're not ingesting enough fluids, and let's be clear that water is water, it's clear, you can see through it. It doesn't have a flavor, it doesn't have an essence, it doesn't have tea leaves in it. You know, it's water. And the other, where the heck did I just lose my little train there?
Well,
We
you
have to have
brought up
saliva. And
correct.
so we need the water to make the saliva, to kind of circle back on that.
And you brought up a good point. You know, what are we drinking? What are we consuming?
Pepsi is not water.
Correct. You know, you think you're getting your liquid intake.
Yep.
What actually is happening when you drink a Pepsi, you need to have some water afterwards to kind of flush it down, because it takes water to dilute the sugars. So what happens is it draws it out of your system.
Yeah.
And we're made up of a lot of water. We're like 80 some
Yeah, it's a crazy amount of water.
percent of water. And so also with an acidic beverage, when you consume that, it's at a pH that is really low.
Yeah.
What happens in your body? You consume that, your body needs to neutralize it automatically.
Yep.
And so it's going to leach out ions, calcium, different, out of your bones. It'll leach out calcium in order to neutralize that fluid in your gut before you can excrete it. And so what happens in your body when you ingest the sugary beverages that are very acidic is long-term just bad for your health.
It's just a bad outcome, right?
It's just a bad outcome.
And then if you're drinking a can of soda and you take an hour to drink your can of soda because you're just taking small sips, that pH is low in your mouth that entire hour, plus the 20 minutes it takes to recover after 30 minutes. So that's a long time for a really low pH, and that's what breaks down the enamel on its own, even without the bacteria. So that's the other secret, I think, that not everybody understands, that you can brush and floss your teeth really, really good, but like the kid we were describing earlier, if that's the kid who's drinking Pepsi or Coke or energy drinks or, you know, most of the normal things that you see anymore, that kid is going to have more cavities than the sister. So we started talking about ways of getting more saliva, and we talked about chewing gum, and we do have a little picture of some of the benefits of chewing gum in general. And we're going to put that up there because I really think chewing gum is underutilized. I think we have a lot of benefits from chewing gum just in general. Wrigley's has the American Dental Association stamp of approval on its sugar-free gums. It has quite a number of gums. So, and I know at your practice you're recommending xylitol chewing gum.
Correct. You have to be careful with even some of the ADA-approved gums. Why? Because it's not all xylitol, and sometimes it's a very limited amount of xylitol in those gums. So even though it says there's xylitol present,
Yes.
what amount of xylitol is there, and what other sweeteners are they using? So that's why we use a pure xylitol gum that we recommend for our patients. And yeah, we have that available to anyone when they come in or leave our
So
office.
can people buy it from you, or do you just have samples?
We have samples for people,
Okay.
and you can go online and
You can buy it
buy
online.
it anywhere.
So we do have a picture of what the Spry brands look like because they're getting more and more into stores. I've seen Spry products now at Target. We don't have too many CVS's around here, but I've heard they're at CVS and Rite Aid, which we don't have at all here. So look around and start asking for it because more and more places are going to be offering those 100% sweetened xylitol products like Spry. If you go to a health food store, you're going to find a couple of others, but I think Spry has the widest variety and the most bang for your buck.
Correct. Yep. As far as what's out there right now, they are the leader
Yes.
in xylitol.
And I'm offering xylitol at Primal Air, so you can come and if you need to, if you have questions about it, we can answer those questions too about xylitol, because it does have a pretty decent, almost a medicinal profile. They're using it in wound care, so xylitol is a pretty magnificent. It's a pretty magnificent ingredient.
So
We're finding so many more things to do with it.
so that's what we're handing out
Good.
on Halloween.
Is that what you're going to do?
Get your xylitol
The
candy.
xylitol candy. So
Yep.
yeah, you can have a lot of that.
Mm-hmm.
And that affects the oral bacteria. That's one of the biggest things that we found with xylitol early on. I did it myself, me and my friends, is that it affects the strep mutans bacteria that you were mentioning earlier that cause the cavities that are present in all of the cavities in teeth.
So yes, to circle back
Yeah.
to the strep mutans.
It just is always a circle.
Yep. The strep mutans, they can't digest the xylitol, and so what happens is it decreases the bacterial count in your mouth, which is good, and also the bacteria not producing the acid that decays the teeth. And so that's a very beneficial product.
Yeah, I really have a lot of good things to say about it.
Yeah.
With respect to cavities, and I touched on it early in our little conversation, is the many different words that we have for cavities. So a cavity is a hole in a tooth.
Yeah.
Sometimes we call it caries, and you can't have one carie. It's always called caries. Just to be clear.
Right.
Um,
Can't call it Carrie.
No.
Then it's just a name.
That's just somebody's name, exactly. We also call it decay.
Right.
We also, what else do we call it? A little stick, because sometimes our instrument will get stuck into a lesion on a tooth. A lesion is another word.
A soft spot.
A soft
on
spot.
a tooth. Decalcification, which is how it starts, which is where the minerals are leached out of it, and that's how it gets softer. Hole in the tooth. I mean, just like you said, the people come in, there's a black spot right there.
Yeah.
It hurts.
It hurts.
I eat something sweet, and it bothers me even more. And so, there's a lot of names for it. But thank you for saying that. Yeah, there's a lot of ways to call it.
Well, and because it gets confusing.
Correct.
For regular people, and that's who I'm imagining is watching this conversation today, that we said, oh, we got caries and all this stuff. So that kind of makes me think, too, that a patient that comes in for their initial exam, and we are marking down all the fillings they already have. So we're not marking all of the areas of decay or cavities. Those are already areas of decay, so don't get those confused. Because that can backfire on you.
Correct. Yep. Another factor, you mentioned. I have a question for you, Shirley. You mentioned, chewing gum with xylitol as being very beneficial. Some people don't have the ability to chew gum, and you're involved in a lot of that too with TMJ problems.
Right.
With myofascial, what are you finding with people who can't chew gum as a good source to help them?
Well, that's one of the things that I like about the company that we mentioned a few minutes ago. I don't want to get in trouble with the FCC here, but there are mints that you can just let melt in your mouth that are very good. You can also buy xylitol as a sprinkling sugar. So there are ways to put it into your coffee and your tea. If you're drinking a smoothie, you might want to put that in there, but I would encourage you to not use smoothies. You can cook with it. You can put it on your oatmeal. There's a lot of different ways to incorporate xylitol into your diet. And, when we're talking about dietary recommendations, we also may want to talk about or just mention that there are foods that are biofilm busters too, not just the xylitol. So things like, what am I trying to say? Turmeric. So if you're taking turmeric, that's a good one. Cranberry powders, things like that. So here we sit again, zipping through a half an hour show.
Happens so fast.
It just kind of goes, what just happened? I think we covered all the territory that we wanted to today, so I hope that everybody knows now how to eat their Halloween candy, because that's really, really important, because you don't want to have to give it all up or throw it all away. So there we go. This is Dr. Peter Lotowski from Wisconsin Dental Solutions right on Main Street. What's your address again?
I'll leave you with my phone number.
Okay.
It's 608-834-6321, and we're right on Main Street, 1265. I should know this. You know, when you're on a spot.
16 years later.
Yep.
Yeah, you don't use that. Well, our address is 1266, and
Yep.
so we're in the same parking lot. You can find us there. So here we go at the end of another Spot for Health. My name is Shirley Kutkowski, and now you know a spot to go for health in Sun Prairie. Have a great rest of the week.